One day after a federal report outlined the denial of an abortion at University of Kansas Hospital, new details from the same report shed light on how a man died in the emergency room waiting. Tonight, the group that led the charge is voicing concerns about what the report contains. I'm Lauren Halifax.
And I'm John Holt. The 34-page federal report details not only how the U.S. Department of Health and Human Services was alerted to the cases, it includes interviews with staff who interacted with both patients. Fox 4's Malik Jackson covering the story for us. He's live near the University of Kansas Hospital tonight. Malik.
Good evening, Lauren and John. Sometimes the details shocking in nature. This describes a woman who was in dire need of help being told to go elsewhere. Fox 4 went through this 34-page report, and it even details a man in the ER waiting for nearly 2 hours before he died. On the same night that voters in Kansas preserved the right to an abortion in the state of Kansas, Melissa Farmer, who was nearly 18 weeks pregnant, was denied an abortion at this Kansas hospital. She had already been refused care at Joplin's Freeman Health. Freeman is also facing similar complaints.
It is absolutely heartbreaking to hear about this story, and it's especially upsetting to think that this woman was denied access to a medically necessary and life-saving abortion at the same time that Kansans were out voting to protect her right.
Farmer claims that after driving to the Kansas City hospital, the hospital told her they couldn't provide the abortion because of Kansas abortion law. However, in Kansas, abortion is strictly limited after 22 weeks. She adds that the doctor said that unfortunately, due to the political climate, it was too hot and heated right now, that they could not treat her, even though, according to the federal government guidelines, her life was in danger. Ultimately, Farmer says she had to drive to Illinois to get an abortion.
And if a hospital is willing to deny patients access to emergency medical care because they are worried about the political consequences, that shows that our leaders have created a climate that is hostile to women's reproductive health care.
But this report doesn't stop there. It details how a 73-year-old man brought to the hospital by ambulance died in the emergency waiting room. The survey saying, quote, the patient presented to the emergency department on September 12, 2022 at 10:38 p.m. with a complaint of cough and was found unresponsive on September 13th, 2022 at 12:34 a.m. in the emergency department waiting area. And it wasn't hospital staff, but another person in the waiting room that discovered that the man was unresponsive. His time of death 18 minutes later at 12:52 a.m. This came after the man's heart rate was higher than it should have been. In a letter to the hospital, the Centers for Medicare and Medicaid Services said, we have determined the deficiencies are so serious that they constitute an immediate and serious threat to the health and safety of any individual who comes to the emergency department and requests examination or treatment for an emergency medical condition. In response to this report, and after we asked the hospital for an on-camera interview, they say the care provided to the patient was reviewed by the hospital and found to be in accordance with hospital policy. It met the standard of care based upon the facts known at the time and compiled with applicable law. There is a process with CMS for this complaint, and we respect that process. The University of Kansas Health System follows federal and Kansas law in providing appropriate, stabilizing, and quality care to all of its patients, including obstetric patients. The hospital said in regard to the man that had to wait more than nearly 2 hours before he was treated in the emergency room, quote, this is a separate matter and we are working through a process with CMS on it. There was a list of concerns that was given to the hospital to follow, and if those practices and if those things are not put in place, this hospital you see behind me, the University of Kansas Health Systems, could lose its Medicare program. John, Lauren.